For Erin Rothney, it's work she does nearly every day here as an employee at the Detroit Metropolitan Airport working for the Centers for Disease Control. It's the same work that prepared her for the trip of a lifetime recently, sending her some 5,000 miles away, putting her right in the middle of helping contain one of the worst Ebola outbreaks the CDC has ever had to deal with.
It was pretty incredible. As a public health professional, this is the biggest public health event of my career so far.
Spending 3 weeks in Sierra Leone last month, Erin Rothney seen firsthand the work being done there to fight what has become a global epidemic.
Well, this is sort of I think the first time we've done this on this scale.
Her work as a CDC public health advisor at the Detroit Metro Airport put to the test. While in West Africa, she spent her time developing plans and temperature screening procedures.
This is a thermal camera.
And training other health officials there in a place with the second most Ebola cases only behind Liberia, all in an effort to make sure passengers flying in and out don't spread the disease any further.
Clearly it's still spreading inside, but we want to stop it from spreading any further to any additional countries.
Rothney, part of a team of 2 working at the airport, along with 40 other CDC staff members dispersed throughout Sierra Leone.
Is our pumpkin in the leaf pile, Duck?
No.
But the trip meant leaving behind her husband and 2 young kids.
I think I knew when I saw it in the news more and more, becoming more frequently. I just kind of mentally got ready for myself that it was going to happen, that she was probably going to have to go somewhere.
So that was probably one of the more challenging parts, was preparing myself to be away from my family for so long.
And even though several of her family and friends expressing fear over her being in an outbreak area,
there were a lot of people that were very surprised and concerned for my well-being, but some that also, I think, realized the importance of working on this type of situation.
It's an assignment and experience. Now being back home, she says, will stick with her.
A lot of education going on to educate people that Ebola is real.
From a country where, while many still try to go on with their daily lives.
So while I was there, I didn't shake a single hand or give a single hug. It was sort of strange.
Many others live in daily fear of a disease that just won't seem to let up.
I was really proud to get to go, that I could be a part of such a big outbreak and try to help, even a little bit in the response. But it is really an overwhelming outbreak that, need lots and lots more people to assist.
And of course, with this Ebola outbreak far from being over, she says there's a very real possibility she could be sent back there. At Detroit Metro Airport, I'm Josh Sidorowitz, Fox 17 News.